My name's Joe Galatly. I'm going to have Cameron introduce himself first, and then I'll open us up.
Hey guys, I'm Cameron Anderson, CIO at Chaz Health, and I've been there for 10 years. Thanks for having us.
Good intro. Nice. Yeah. Let me get us started here. I've had the privilege of getting to volunteer on the Chaz Board of Directors for about 17 years, and Chaz Health is one of their core values is entrepreneurship, and they're just innovative in technology from the beginning. And so, very excited to have Cameron here be a part of this conversation because he's got some very practical actions that he's taken to implement AI. And I think if any of you sat in on Richard Harris's talk on the main stage yesterday, I think he teed it up really nicely. It's a good foundational message, and we're going to roll up our sleeves and get into it here. So. My day job is Medcurity, and Medcurity does the security risk analysis for health centers that you got to do every year for HIPAA and OCR and CMS and FDCA and all the acronyms. And it gives us the opportunity to travel around the country, work with health centers all over. So I like these talks, share some trends and some things that we see in the field, bring that back to you guys. We're based here in Spokane, and I've got a few team members here. Mel, Molly, Rachel, and Jordan here. And we're excited to be hosting. So thanks for coming to Spokane and being a part of this event. And I had just a quick story, and then we're going to jump into hopefully some inspiring examples of what Cameron and team are doing and other people in the field. So this week, I was in Louisiana with Rachel. We were doing a security risk analysis, and this customer said we could talk about it. But Louisiana is great, right? We were down there. Half of the reason we're down there is for the food. If you guys go south, right? The food is incredible. It's so bad for you, but it's so incredible. And the clinics told us that cardiology is thriving down there. But we have some of that catfish or beef and grits, and you're like, it's worth it. I'll go to the cardiologist for this. But we worked with an organization that we asked them about AI pretty early on in the SRA, and they said, our stance right now is to kind of wait and see. We haven't done a policy, but we did an email out to the entire organization, and we said, kind of holding pattern. Don't do anything yet. IT's pretty busy, but we're gonna embrace this eventually. We're gonna figure out how we're gonna take this on. And we said, well, they're probably doing it, right? There's probably use of AI in your employee base, your provider base, until we put until we get our arms around it. So part of the security risk analysis is to do walkthroughs, right? That's a really important part. You go do the walkthroughs. And so sure enough, they're teaching abstinence, and we're like, there's a lot of desire out there, but we're going to see what we find. And it's not a very good metaphor. We logged into a computer with the Post-it note password that was next to it, and which is why you do walkthroughs. And a provider's clinician's a chart was up, and then behind that was a scribing solution. So if you haven't adopted scribing, AI scribing, this is changing the world for the docs that have it, the providers that have it. And so good thing we have this innovative provider that's pushing the boundaries there. But then when you look at that, you're like, well, we don't have a business associate agreement with this, and we don't, we're not getting patient consents that we need to do. So that's the problem with the pace of this, is that it is being adopted. It's being adopted quickly. And we're telling them, it's great. They're going to respond to this. They're really a responsive organization. I want to say where they're teaching abstinence, but we said, you got to have compliance as a condom here. You got to have some options here because they are going forward. So let's figure out compliance. I probably will never say that into a microphone again. But I want to encourage you all to, as part of this talk, is to get started with this, understand how your organization is using AI right now. We're going to talk about policy. We're going to talk about how to get a pilot going. I think one more thing before we jump into specific examples, I want to just get the tempo or the posture of the room right now. So if you are net optimistic about AI, just in general, for our world, for our life, are you more optimistic than concerned? Okay, that's fantastic. How about more concerned than optimistic? A few of you, okay. Kind of in the middle, waiting to see what happens? Yeah, okay. I think that net consensus is yes to all of that. There's some big societal issues we want to be concerned about. We want to be really aware of as we jump into this. But leaning into it, like it looks like many of you are, is what we're going to encourage here as well. we've seen healthcare adopt AI in a way that we have not adopted technology. I've been doing this for 20 years, and we have not leaned into technology as fast as we are right now with this. And we're still faxing, and yet we're doing cutting edge AI in the clinics. And you can see it in charts like open evidence, just got it picked up, in about a year's time, picked up about 2/3 of the clinicians in our country are using it. So it doesn't feed PHI into it. It doesn't need protected health information. So maybe that's part of the reason it's growing so fast. But this is as people find a way to use it, the takeoff is amazing right now. So I'm glad we're here. Glad we're talking about it. To get us started, maybe for some inspiration here, we've got a whole bunch of things up there, ways that you could implement AI. Like I said, we want this to be really practical. So I'm going to turn it over to Cameron for a couple examples. Again, just what have we done in Chaz? And again, for the inspiration of everybody in this room, what kind of wins have you seen? I put a couple things in bold: revenue recovery, patient access.
Yeah, that's the problem, is there's so many use cases and limited resources to build them, but we're trying different things. Real quick, has anybody built anything internal using AI yet? Cool. Do you want to share? No?
Healthcare provider credentials.
Okay, sweet.
We're using a virtual scribe,
Oh yeah, good.
Which scribing?
DAX.
Okay.
Yeah, and that's what I had a conversation earlier. That's generally what I direct people to first. It's such a slam dunk. The virtual scribe, like the ambient AI. Our providers are all super happy. It's super easy, plug and play. It's a very big win if you are in charge of IT or ops. So
The feedback we're getting is, if you take it away from me, I'm going to leave.
yeah.
Well, just and underscore that for anybody that hasn't adopted AI scribing yet, that we're your paranoid risk partner, right? We're the ones that are going to tell you, to be very careful. We're security and privacy, but it's shaping up to be a bigger risk not to adopt it. If you want to recruit providers next year and they have to type, so anyway, back to you.
Yeah, easy win. But yeah, that revenue recovery, we built an internal model that goes through and looks to see, based on contracts and some data, what things we were supposed to be paid, and then finds outliers. And then with a few of our big plans that have been run so far, it's about $300K that we were underpaid. So just using internal technology to source how we can get some extra revenue. And then we're also using that for like contract negotiation going forward. What are some other good ones that we've done? Last Friday, we're doing these hackathons every other Friday with some of our data scientists, coding people. And so we're really trying to get them to use these new tools to expand how they do their job every day. And so we're kind of forcing them, hey, let's pick an item from your ticket list, your work list, and just see how we could use AI for this. And so we just set a goal. We're going to have this figured out in 2 hours. We'll have a solution. So without getting in the weeds, we were having to pick up a file from an insurance provider that happens to change every time they send it because it's not standardized, so the fields are always different. And so the task was a human task to go in and eyeball this, eyeball that, see what's changed and what do we need to do to get this into the data pipeline correctly. So using AI and some modern methods, in 2 hours we were able to have a Python script that pulls this file in, finds all the data, uses a local AI model, and we ask it all the things that a human would do, and it corrects them, and it turns on a dashboard for a human to look at and say, hey, here's the 3 things that I think was wrong. Does this look right to you? And they click yes, 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 and then it goes into the data pipeline. So that's the speed at which these problems can be solved today.
I want to make sure you caught that he's doing is it every Friday, every other Friday?
Every other.
Hackathon. So just turning people loose. One of the things that Richard said yesterday was encouraging curiosity, right? And experimentation. And it sounds like you've created a safe space, in Richard's words, to do that and explore. Workflow efficiency. Anything else on that piece?
Yeah, we've got I would say one of the biggest challenges is kind of ties to that is the security of where you're sending your information. Can you guys hear me? There are a lot of hoops that you need to go through to make sure that you're not giving your data to somebody that's going to misuse it or that's going to be not protected. So once you get through those hoops, then you could use these large language models that are like, if you go to Chat GPT, these really powerful ones, but they're in a protected environment. And so we created a tool for Chad. Chad, what does that tool do for you?
Yeah, so we started using just kind of regular AI, obviously clean, running it through Cameron and his team. But with one of the jobs I have at Chad, is I'm in charge of the FP&A team, so it does all the internal financial statements and all the narrative around that. So, and even though most of our team is pretty data sensitive and loves data, they were really concerned about using AI. One, I'm not sure if it was going to replace their job or whatever, but what we found is what was taking them every month end, they were spending at least 2 days on this narrative. And so with AI and just kind of the free version of AI with ChatGPT and some of the others, we've been able to reduce that down to about 10 minutes. And so now they're just dumping in. So with a really simple prompt, we're dropping in our graphs and our images, and then asking, as an FQHC, provide financial narrative on whatever the chart is. And the cool thing then, in what I was kind of talking to the team about, is now we can live into kind of our true brain power. Live into your strengths. We're not spending 2 days on repetitive tasks. AI is doing that repetitive task. So then we can do a deeper dive on whatever the variance or whatever we saw in that. So they're actually loving it. They were very skeptical to begin with, and a couple months later they can't live without it. So the other thing too, which is kind of, I don't know, against what I was thinking originally, is humans tend to be pretty repetitive. So a lot of our narrative was very similar month after month. AI can change that up and does change that up. So our narrative actually is better in 10 minutes than what it was after 2 days of narrative. So before. So, and then, yeah, again, the main thing is that instead of doing the repetitive tasks, they're living in kind of the top of their license. I know that's a provider talk, but it's been huge for our team, and it's been actually a morale improve for us.
Yeah, and that's all done in a secure way, and we control the actual front end that team uses. So we can, if we want to change the flavor, or we want to all that stuff is all configurable for what they expect the output to be. And that's just another simple use case that is not super difficult to do. One thing I wanted to, do you want to talk about the Spark yet, or no?
Go for it.
Part of this, yeah. Okay. So with all these challenges of, is our data safe here? Do we have BAAs? Even with BAAs, there's other challenges. What are the things that we can do without needing these giant models that we could do on-prem, inside your protected network? And so we started with building a couple servers on our own before this technology existed, and because we want to run PHI to find patterns and do different jobs for us, but we don't want to risk sending it out when there's all this moving regulation and everybody's changing their terms all the time. So we built some servers that was successful, and then a company called NVIDIA that is behind a lot of the brains, or the hardware behind the AI, they came out with a piece of hardware called the DJX Spark that I would recommend anybody that wanted to dabble with on-prem AI get, because it's out of the box. I will show you. This device is super powerful. It can run what your experience would be on chatgpt.com locally, and it's tiny. That's a supercomputer. So it sits on your desk, and it's quiet, and it does high-level AI. So we could run probably 90% of what Chaz needs internally on a device like this.
It's a good example of, at least for the short term, some experimentation to get your arms around this without as much risk. Yes,
Yeah.
sir, in the back.
Could you explain the significance of doing this within a closed system environment? Because I think that's a really important principle around data security.
Sorry. One of the things is these models are getting to the point where they've learned all the text that exists. So the only way for them to improve, they're adding more horsepower and actual power. They need more data. So a lot of these companies are taking your interactions and using that to train their models because that's fresh data. It's more valuable to them. So without agreements and safeguards, your data would be used to train these models. And if you're putting PHI, I mean, there's some rules against that. And it's technically you're technically able to do it without any of those risks by doing it on-prem. And it depends on the use case, sorry. Like if it's non-PHI and you just, maybe you have some data that you've like obfuscated or something. I mean, there's good use cases like I need a really smart, powerful model to do this, then it could be safe. But especially for your teams that they're trying to experiment and do things, then I would recommend you make sure that that environment is safe.
Yeah, it's not everything. There are instances, like Cameron just said, that you can free your team up to go experiment on public models, go plug something into ChatGPT, use Claude. But we got to define those. We got to put some pretty clear guardrails in place. So that's where we'll talk about policies in a moment and how we get started with pilots so we can understand what needs to be on the box in-house. But yeah, it's an investment. I mean, that supercomputer's like $4,000, right? $4,000. So it's an investment to get started. Yeah.
I noticed you don't have much about grant writing up there. We use it a lot for looking up data, and we're looking at doing something like on a prison. It's sometimes hard to find that data, and ChatGPT is way faster.
That's such a great example.
You don't have to necessarily put all your information out there, but you can pull a lot of information very quickly within minutes, where it would take days.
But don't you miss the days of of writing narratives? And no, incredible example, and a lot of things that are parallel to that, like education, creating content for education, and grant writing. Yeah, it's a fantastic example too. Anybody else want to throw out any quick examples of what you've put this to use for in your clinics? Not yet. Okay, keep thinking.
One quick that I just thought of, we had this problem with a lot of the charts being messy, and there's like old meds and inboxes are messy. So using AI, you can feed all this stuff internally and say, hey, poke through all these things. Which ones do you recommend that are not legit? And then there's some other math and logic behind that. But you end up with a list that says these things should not be in the chart. And then you can generate a script and run that through your EHR to clean that up for the provider instead of a manual person going through each chart and eyeballing everything. And I think it saved us I would say the wrong number, thousands of hours when we calculated it. So,
can you break that apart? So if you're not IT, we created basically your own in-house application to review problem lists.
Yeah. It just on the back end.
Back end of Athena Health for you guys.
Back into Athena Health, it goes through and pulls. And I'm not clinical, so it pulls the things that shouldn't be there, all of the things, and then it uses the large language model with a prompt that, when you're a human and you're thinking, what is my job right now, I'm doing this, that's what we instruct the model to do. And so it goes through and does its thing, and it's extremely accurate. And then there's some checks in place, and then it turns out a list of all the things that a human would have flagged to be pulled, and then we automate that getting pulled out or archived.
So you're letting it actually write your database?
With some human review.
Mm-hmm. Anybody else using AI scribing tools yet? Okay, Gil. What tool did you end up with?
I forget the name of the tool, but
Okay.
it's integrated with Athena. Also, we use Athena. What I thought was really impressive is I had a patient visit with my provider in Spanish, and it translated it into English into chart, and it was so well written. The chart is so well written and captured all the labs, all the screenings that were done in such a concise and of course the doctor had to review it, make sure it was test to it. But it was incredibly accurate and well written.
It's a great point too. I think, doing this talk a couple years ago, we had concerns, equity concerns, and there still are some in the data, but now we can see, the documentation tools can reflect language and nuance, culture, things that no one person could, understand or be able to communicate in all those different ways. So just another powerful place where we had some concerns up front, and then we said, actually, this is even better. I think back to Chad's examples, thank you for that. Those are a great way of illustrating the low value but high effort work that we could start with, right? Looking for those things that are repetitive and not at the top of the license, and scribing is a great fit for that. Writing narratives that are repetitive, and then as Chad said, then that team gets to go and deep dive and go work with the service lines and say, okay, let's look at what we're doing here in greater detail. You get to use your time in better ways, and hopefully for the foreseeable future, that's what this gives us, is a way to take some of that tedious part out.
I'm going to add one thing on the AI scribe that is the common theme that I get back is, because it's AI on the back end, it's not just like voice to text. It's it's smart enough to not pay attention to the things like, hey, my grandson did this, and it literally just pulls exactly what needs to be in the chart out of that entire hour-long conversation and ignores the rest, and it does it accurately.
We can talk through a couple more examples as we go. Sorry, go ahead. Did you?
I was just going to say, we haven't got it yet because we're going after some funding for it. But for our medical team, we're going to use the next gen ambient listening. And then for our behavioral team, we're going to use Helios.
Okay, great.
Cool, good.
Chaz ended up with what tool?
iScribe.
iScribe. Yeah, I think we'll talk about vendor selection, starting pilots, getting a few to the table, maybe 3 or so solutions that have, pilot to test, to try. Kyle, Athelus, you guys have a solution for this. I think lining a few of these up and seeing how they interact with your EHR. But this, Gil?
Well, I just want to highlight that charting is historically been the biggest stressor for providers. In terms of seeking more patients, it's not that they would tell me, it's not that I want some more patients, it's the behavioral is supposed to work that I have to do. So this tool has been really transformational in that.
A lot of the organizations across the country we talk with that have done this will echo those comments. There's not regret once you got it in. And then 6 months ago it was rougher, right? But now, pick the solution that's best, get it in place. And I think the CFOs will tell you, dig deep for that money. Hopefully get a grant. But if you don't get a grant, do it anyway. There's not much more of a high impact, high value change you can make for your organization right now than giving your providers hours back per day, getting charting done near immediately. It's tremendous. So that's, if you're looking for a starting place, as Cameron led off with, that is one where you have vendors you can trust that are already vetted and can make this happen for you, and the payback is quick.
And from a risk perspective, like the quality, they're great now, and it's every month they're better. So, and did you have a question back here?
No, I was just going to say, our organization utilizes Clarity. It's an ambient AI. We also have a significant behavioral health component to our clinic. We found for the staff that have deployed it, their ability to, when they're charting, they don't have to go back and try to remember a conversation. The conversation's already there, and they're able to, it's tremendously increased their accuracy, and it's been a huge benefit for them in terms of the time and spent documenting.
Absolutely. Providers are telling us they can focus on the patients more, and that's huge.
So we use free AI, and our turnaround time, I think we went from 5-day no closes to about 3-day no closes, and saw a 70% increase in 3 or less days. Our 1 days are immaculate right now, saving a lot of time, but it's integrated with our behavioral health too. And all I did was manipulate the note to fit the behavioral health side, and it worked out great in that manner, and we didn't have to change anything. And we're also starting to get into the coding piece of that for our providers who are struggling with coding, which is going to make a huge difference come here in the next few months, because that's part of the provider burnout that we're seeing was notes, but then how many chart reviews you have to go through and under or over coding and things like that. So compliance was a big thing.
Comments on coding?
Yeah, it's great. There are two sides to that from what I understand, and then the back end billing side, there's some really good products. We are running one, I forget what it's called, and then there's some other drop-in modules. I think the one we're using provides one as well that just is kind of like that as you're navigating the chart, giving you examples and ideas of what might be a better fit. So that exists, yeah.
And the coding's, it's accurate, incredibly accurate, and
It's, yeah.
yeah. So, I mean, we want to name some names because, like I said, I want this to be a session where we are pretty practical. Like, the sleeves rolled up, let's get started. So that's why I appreciate people sharing vendors you found. We're not selling any of this ourselves. Like, we just want you to be, as health centers, leading the way in this, experimenting as soon as you can, adopting some tools in this area, and don't let it become an advantage for other organizations. So we just want to encourage you guys in that. So let me jump through. So this is pretty brief, more on the liability side, I guess, just in summary. AMA, NIST, some of these national organizations have put out standards. We're tracking that, of course, as part of our compliance world. But basically, the clinical judgment stays with the provider, and a lot of the guidance so far is focused on the developers and how to develop products that fit. So, it's, I think the hardest thing that's happening right now is state by state. There's regulations coming up for what you're allowed to record, and when you have to tell people it's AI, and a lot of complexity coming at a state by state level, which is difficult. We'll need some federal. I think there's some federal work underway, but we'll need a federal rule so we all can, especially multi-state health centers don't have to juggle different requirements by state. So tracking that, not a lot to share yet. There's nothing really limiting us from plunging ahead so far. So that'd be something that in this talk, maybe next year we'll say, okay, hold up over here because we've got some new regulations, but we'll watch that closely. It's all pretty common sense so far. Talk about challenges. Anybody have any challenges yet on the AI side? Is there a little bit of hesitancy in the organization, hesitancy in providers?
Some of those have changed their mind as I've seen their peers utilize it, and the point is some of my providers have it now. I can never take it away from them. They've got, and then some of them that were no are turning.
They see their peers going home at 5 p.m. Like, what do you do? How are you doing that? Yeah, that's great. And some very technologically adverse providers I've gotten to speak with that this is the exception. So first time technology has ever helped.
The only ones, we still have a couple of doubts at my clinic, and one is going to give it a try. But I think the one of the two that's holding out, he has done so much front-end work building all his macros and stuff that he's got it so efficiently done that I don't know if I'll get him on board.
Such a fair point.
Fear that the patients wouldn't accept it either, feeling like, but so far we've had, patients are giving their approval overall. It's very rare for one to say no.
Those are multiple good points there for the culture shift. And there are some organizations have just taken their forms and made them so custom and so beautiful and automated. They're going home at 5:10, so they don't change their whole workflow to go home 10 minutes earlier or whatever. But so I think some of that will probably persist, and you can sustain that environment for them. It's going to be recruiting. It's going to be the new providers too.
I have a question about that. I've been on both ends working in healthcare. I've also been a patient where ambient AI is being used. And have people brought up concerns about where the information is going that's not really going into the chart?
It's good to equip your providers to be able to answer that in case that question comes up, because typically it is pretty contained. It's going to be potentially, I don't know how you guys are doing it, but an iPad in the room that captures some of that and then purges it, takes the notes over, purges it after a certain time period. But any comments on where the data goes, Cameron?
Yeah, I mean, it's going to their cloud. You've got agreements with them, and then there's it'll be in the contract, but like how long is retention for that data? So you could tell them I want it gone as soon as the chart's updated if you want, Sometimes providers like to go back and listen to, if they're like, oh, I thought this was something, then they can go into the log and see what the recording said.
But we want to be able to answer the question, succinctly, and that is, well, I don't know, but how often it's coming up. But imagine it's coming up occasionally, and it's probably in the consent form that the patient signs to help them understand that.
Yeah, we create a frequently asked questions for all our providers so that they can answer those questions when it does come up.
It's, I think, more quickly accepted than a scribe on the phone in the room. Like some other things we've tried for automation here, it's a little easier to understand the length of time we keep that data, where it goes. And
I think, too, a lot of these, like we went through all of these comments, too, when we first started, and the patient appreciates more than any other issue that they get to sit down with the provider and look face to face without a computer there. And so it's that just solves the problem.
Oh, absolutely.
Yeah.
That's been the biggest thing for the last 15, 18 years, patient and provider satisfaction. You've got this screen and you feel like you're really being listened to.
Yeah. Yeah, when it opened, I don't.
Or a year and a half. I am the clinic administrator there, and so I get all the complaints. And I think I've had 4 from patients that just didn't appreciate even being asked if they could be recorded. But we see a lot of patients, so that's not a lot. And when I try to explain that, we're just trying to eliminate that computer between them. I've actually had 2 say, okay, they can do it next time. So I think it's about that conversation.
It's a very small fraction of patients raise the issue, and then you converse with them about it, and we'll have a couple holdouts on everything for a while. But yeah, that's a great example. Thank you, Clint.
So when we're talking about data privacy and security compliance, like if we're doing a good job internally of having a security program and what we're doing, I think the practical part that some people struggle with and what we're struggling with is, what do we need to add on to actually bring AI on board, right? Because you get a lot of noise about, well, you have to make sure it's not biased and all these other things. But we don't want to recreate the wheel either with what we're trying from a security program. So do you guys have anything to share on that? Am I jumping the gun?
No, you're not. No, it's great. I think a lot of what we're doing dances around that, because we're taking administration, we're grant writing, we're taking all these elements that are not, I mean, the bias isn't a big part of that, right? And then we're taking the documentation and coding and everything after that. The clinical judgment, open evidence was referenced earlier, like that supports the providers. We haven't done a lot of, I haven't seen as much decision support beyond the algorithms we already had. I mean, it's there, it's going to be amazing. But I think the entire healthcare is figuring that part out of the data we actually use that will impact our clinical decision. Information open evidence is just all of the studies, all the research, right, in an actionable way.
Right, so I think kind of what I'm driving at is, if I already have the AAs and all these things that I jump through for technology already in my organization, do I really need to do a lot of extra work to onboard something like AI for ambient note taking?
Probably not ambient note taking. It's a good starting example.
Yeah.
Cameron comments.
And I would say no. It's kind of the same process. You just there's a lot of different ways different providers offer BAAs, and like, so it's not as standardized as your normal tech, because these are like a lot of times startup companies that are, you know, pretty new. So yeah, I mean, from a policy perspective, just make sure you're following all those compliance check boxes. The other piece of that about the bias, I don't know that there's been a solution that we've developed yet that doesn't have human in the middle. So like, you tee things up for somebody, generally it's just doing all of the manual things and saying, hey, here's what I need you to look at, and then a human's verifying that this makes sense. So it's not just complete automation and the model is doing something. There might be good use cases for that, and we might have done something, I can't think about it. And another thought is, we built a model that predicts no-shows, and there was a lot of those questions. We have this like AI governance committee that's kind of thinking through some of that stuff, and there were questions about bias, and like, if you're looking at these indicators to say someone's going to no-show, is that the right way to predict something? So what we ended up doing was, we used AI to find all of these research papers that have built similar models, and then kind of went through their methodology as supporting how we built it.
Yeah, I think let's come back to that question too if we don't answer it in the next couple slides too, because we'll keep going down that direction. A couple of the other challenges up here that maybe are their entire talks in and of themselves, but things to be thinking about: leadership in health centers, put reskilling and realignment. This is why we encourage being at the edge of this, studying this, watching it, being in talks about this, is because there absolutely will be impact on the workforce. There's roles that will change dramatically in the near future. And as health centers, we're not the first ones to just say, well, let's cut that team. We don't need them anymore. It's a lot of work to recruit, and we have people that are passionate, part of our mission that we want to, repurpose if we can. So I think we've got to be paying attention to what tools are working, and just strategically thinking ahead to how do we keep our workforce engaged. What's the next role for coders to grow into? These are really big questions. Again, maybe a whole brainstorming session on that. It's worth it, but I want to just raise that so you're starting to think about that. Yes, sir.
Maybe clarify for me, in our adoption process, it seemed like it was important that we work with AI options that were within the Athena marketplace, in the sense that they were, Athena's our EHR. It seems like that was an important distinction, so that we had some greater confidence that Athena was integrating this additional application
Yeah, that's a great option. I know about their what's the more disruption please marketplace process. There's things that we've built that we actually have to work alongside their development team before they approve certain things that we're doing. So they go through and check, does our code make sense? It's kind of the things that these vendors that sell those products on the marketplace go through. So I could say, from my perspective, they do a really good job of making sure that those things fit and are safe in their marketplace. And I would say, if you don't have the resources to do things internally, that's a great option.
Little inside information on that too. Can I share about this team? Probably. But we're working with Athena so next year to be part of that security vetting process for their marketplace vendors. I mean, they do take it very serious. They're adding some more components in, and Medcurity's at the table with Athena Health on how to do that vetting from a security and privacy standpoint too. But it's usually trusted if it's in the marketplace. They have a relationship there to start with. So, but there's tools outside of it. Freed's only been around a couple of years. I've ran into it quite a bit around the country. People are using that. They find tools that we trust and understand, again, where the data is going. I think Freed by default deletes data after about 30 days. So there's kind of understanding those parameters of it and trying and finding out what works best with the providers. Okay, I think this will thread through other things we're talking about here. So just specific to vendor vetting, we've covered some of this, but any notes, Cameron, as vendors are brought to you as potential solutions, or how you go out and select vendors?
Yeah, we have we call it our hardware software review process. It's always expanding as things are changing, but whenever somebody would like something, it kind of goes through this review of all the departments. We do like a security assessment with our security team. There's the compliance component, so everybody kind of goes through and makes sure that all the things that we're supposed to do required by law and the things that we require for like our specifications or like how we standardize things in our system, those things are met. But like specifically all of the SOC 2, like making sure that these companies are not run out of someone's garage and not taking care of your data. And but yeah, so I'd say there is a need for a specific process where everybody's had their eyeballs on something before you pull the trigger.
One of the examples where that wasn't done outside of healthcare, if anybody saw this Disney incident where someone downloaded, I think it was just image generators, but it was an AI tool for fun to kind of help them with their job, and that AI tool had embedded malware in it where they ended up exfiltrating all of Disney's like movies that were unreleased and all this content from them. So we're seeing those kind of examples where you don't want Wild West. We want some rules of engagement. We want look for tools, but have the IT and compliance involved in vetting those. If we take a moment here and can I have Jordan talk. So Jordan's a senior business analyst with Medcurity, and part of what we do is keep policies up to date for everybody. And she put together a very nice AI policy. What are the components of an AI policy and any reflections on vendor vetting too?
Yeah, so with AI policies, you're really setting the foundation for AI compliance within your organization. So it's really important to have a lot of safeguards around this and education and training. So very similar to what is on the slide here, it's going to be really important to just talk about how pre-approval needs to be required by your organization before staff are actually using these tools. We see often a lot of times a lot of sticky notes with passwords to their, ChatGPT logins. And it's so important to provide education around AI as well, because a lot of these tools are a very open platform, and you don't want to inadvertently put yourselves in a position where you are disclosing patient information. So along with that, it's important to do risk, bias, and security assessments, as you alluded to earlier, and just checking for hallucinations. So I'm sure we've all come across that, where everything has been flowing perfectly all day and all of a sudden it says something way out of left field. So we want to make sure that the programs that you're using don't include those things, and what to do in those instances if there's any reporting strategies involved with that. Also including encryption, minimum necessary requirements, who all actually needs to use this, does everyone need to have it, and make sure that there's appropriate training on how to use it properly. A big thing that I've been talking a lot about is incident response and contingency planning. So something to think about as well. If this, application that you're using becomes a part of your everyday process, what happens if they encounter a breach? What are your next steps that you need to take? As well as what happens if they go down? you have to have downtime procedures for that too. So you're bringing on an additional layer of efficiency, but it also comes with a little bit of background work just to get it up and running. Making sure your BAAs have an area for AI, and make sure that your contractors are letting you know if they're using it, making sure they have safeguards in place as well, because you don't want to leave yourself vulnerable there as well. And also making sure there's ongoing monitoring. Audits do need to be included in that to make sure people are using the information properly and they're using the program properly. The last thing you want is to deal with misuse or a security incident because of that.
Maybe more than anything in a while, there's a big disconnect between what leadership thinks is happening in the field and what's actually happening tools-wise in the field. So just, and as a side note, if you come alongside someone who's been an early adopter, I think most of the time the right thing to do is to enlist them on the team. Say, great, you're an innovator. Just let's do this together. Like, bring them on. You mentioned a compliance committee. Who makes up the AI? I'm sorry, AI governance committee, Cameron. Thank you, Jordan. Was there anything else that cut you off? Okay, thank you.
I'm trying to remember. Ops is there. Compliance is there. IT is there. Our security side's there. And our communications folks.
Great.
And then, for training and development and that kind of stuff, for developing materials, teaching our folks how to do things.
So have you put out training to the workforce about AI in general, AI usage?
Jamie, have we done that?
Yeah.
Yes.
Great.
I thought so.
Yeah.
Does your process involve gatekeeping, meaning, hey, and if you want access to this tool, you must first do this training, sign this policy, like kind of do this due diligence thing, or are you just saying this is part of your job, use this tool?
I don't think we've done that. This is part of your job. Use this tool. We like from a change management perspective, we have a team that goes and says, what can we help? We say, what part of your job sucks, and then we address that. And so we build that with them, and it's like a product that they help develop. So we don't go from the stick. It's more the carrot approach.
I love that question. I've heard it referenced a couple of times. What part of your job sucks?
Yeah.
Let's start there. Let's see if we can do something for you.
Yeah. From a policy perspective around what tools are people allowed to use, we have the ability, most of you probably do, to say, yeah, you can't use chatgpt.com and just block it. There's some people that are taking that approach. We try to communicate what our policy says. It's like back in the day when you pulled up Gmail, you could put a spreadsheet with PHI in there, and that would be bad. So we try to not limit them, but we also say, here's the risk. This is the policy. You can't do this, but here's this tool that works really well, and this is safe to use. So if you guys have the Microsoft 365 suite, this is what we use their Copilot for, and it's gotten really good. When it first released, it was difficult to try to tell people to use it, but and there's some little indicators on the thing saying this secure conversation, and it stays inside of our walled tenant. So we direct them to, hey, use this tool, and I think the success is pretty good. Yeah.
Is Copilot an additional license with 365?
I forget.
You know off the top of your head? Okay.
I think maybe E3 and above or
It's
something.
with E3 and above? Yeah, great. Well, that's good.
Business Premier has it.
Okay. Because it falls under that BAA, so it's you're looking for safe places to allow experiments.
So a lot of health centers are a lot smaller than probably Jazz, and so they don't have a robust IT department, so maybe you have one IT person, you're outsourcing a lot of your stuff. That's one of our biggest challenges. We have me, who was a CFO, and now I'm a CEO, trying to navigate this world.
I think easy wins, honestly. If you guys aren't doing AI Scribe, easy win. The Copilot stuff, easy win if you have Microsoft. There are some things that are pretty plug and play out of the box that you're not doing customizations. And if you do it the right way, it's safe and cost effective.
We're aware of that jumping in here. Like some of this is it's aspirational, right? It's great that they've got a big team that can do some of these things. We've got an excellent team. But yeah, I think to echo what Cameron said, finding safe places to allow your staff to experiment. So you're not just saying, don't do this because we're not around to look over your shoulders. But if you have Copilot through your Microsoft licensing and you can say, go in there, try it out. It's under the BAA. We can use it. Tell us the best things you found last week, or, create a wish list of things we want to try. It's giving a place for that experimentation to happen and to not have a default restrictive mode, but maybe a default guardrails mode. Here's how we get started with it. And then the easy wins, like Cameron said, too, is a good starting point. Vendors are more important in that scenario because they'll come to you with pre-built products and you don't necessarily need a $4,000 supercomputer because you can get a vendor to do some of that for you, too. Yep. Was it Jonathan? You guys, as I was going to say, we got an AI vendor sitting here, too. Is there anything else that you would add to vendor selection questions you think health centers should ask?
I think these are excellent questions, and actually, full transparency, I'm over the sales team at Relation, and we are not an AI-only company. We are a primarily engagement access scheduling company that has introduced AI because, well, I mean, the hype and the buzz is out there, and frankly, it is powerful, but this is one of the things that we've been talking about a lot because as a company that's been around for 13 years, we do this kind of stuff, SOC 2, all that kind of stuff. And there's a big concern in the market about a lot of the startups that it takes a couple of years to get SOC 2 certified, right? So if a company's been around for less than 2 years, that number one bullet right there should be a big one.
I'll echo that. There's people that are vibe coding, people that are building products very quickly with AI now. There's going to be, and there's started to be, just a surplus of software for everything you could want and need. But also pretty consistently in the market, the consensus is a lot of that had no security as part of that. They're just like, build me something that does this cool thing, and then putting it out in a marketplace. So security is an afterthought at the moment.
I'd say the other thing I'd throw out there too is, are they an organization that understands healthcare? Something like an iScribe does. They've been in healthcare for a long time. But there are groups that come over from hospitality industry, right, and go, we're offering AI for healthcare. Like, well, do you understand the nuances of healthcare? They might, but it's a good question to ask. So it's happening, back to what you said, so rapidly. I like what Richard said yesterday about the responsible AI vendors, and I think at the end of the day, you need to be solving a problem, not just getting AI for AI's sake. So have a problem
100%.
statement, solve the problem statement. Don't start with AI first.
Yep, well said.
Problem.
Well said. Yeah, Kyle.
So I'm a vendor for an AI company as well, and I think another thing to maybe consider is finding vendors that potentially have forward deployed engineers. So someone who might actually come on site and be essentially part of your IT team to help implement things effectively, and they essentially stay on site.
Yeah, good point. Those resources are available for sure. This is maybe moving into how to get started, as it says, so this and then pilots. And I think we've covered some of this. I don't want to be repetitive too much here. So we've talked about understanding current use. Did you have any way to engage like how people in the workforce are using AI right now? Do you watch internet traffic? Just ask people. Any steps on that?
Yeah, we'll do a report like at the firewall and see what sites people are hitting. And then, we try to be connected with all the different teams with some of our folks. Like we, go through workflows and try to help them like that kind of stuff. So we kind of know, but yeah, a good place to look is what's going through your firewall.
So even with an IT team of one, I think it's a good question to ask and say, what is the traffic right now? What is our usage patterns? Are people on it every day? How are we adopting it? Steve?
Yeah, I was just going to mention, I'm a supplier as well to the community health organization. We run call centers, so got over 2,000 employees in northern Mexico handling scheduling and live agent calls, referrals, and all this. But we have an AI side to our company. But I want to emphasize again the tremendous importance of having a very strict internal policy around the use of AI and using your firewall, like you're talking about, to limit who has access to it. I mean, one of the things that keeps me awake at night, and we have really strict protocols and policies with all of our 2,000 plus employees now. But the number one thing that I was most afraid of was like, one of our ops managers in good intention, we're
dealing with patient health information all day long for all of our 100-some plus community health center clients. And so my biggest fear was good intention of our ops manager doing analysis, just going to use ChatGPT to upload a PHI file and do some analysis. And I was like, that cannot happen. It's like, so the tool has to be allocated to very specific people, I feel, at least within our organization. So just managing a large workforce is super important to keep strict protocols on it.
Thank you, Steve. Yeah, I think the training piece of it, so everyone's aware of what the guardrails are, what they can do, and what we want to have run through IT. Absolutely. We'll come back to security a bit. There's definitely some impact that's kind of interesting I want to share on the security side. But specific to the pilots, we've talked about, you got a little hackathon every couple of weeks. You've got a governance committee. Are people sending you ideas? What sucks about your job? Are you are you putting IT around different service lines and saying, watching for these needs? Are people submitting ideas to you? How do you select a place to start pilots?
Yeah. So we've intentionally create a team that's going and talking to leaders and asking these questions. What are the biggest challenges that you have? Generally, it's like organizational or strategic, like what, we need to increase revenue. What are these things that are challenges for us? And then kind of what's the biggest bang for your buck with the effort that you put in? So getting a giant list and then prioritizing by, this is the lowest effort for the biggest impact. If we generate a application that can fill these slots that just were empty because of a no-show a day before, and really easy use cases, things that you probably can do 10 years ago, but you can create these applications in a day now. So like if we put effort into this problem and we can fill these open slots, then that's going to generate X more visits and access. So
my favorite brainstorming tool right now, definitely ChatGPT.
Yeah.
Like if you're not doing, and hopefully many of you are at that level, but I put the voice mode on in my car when I'm driving to the office, and I say, give me 3 things I can do that take less than 1 hour to build out. Right. So if you're kind of just stuck saying, where do we start? This is a simple use you can use it in everyday life too, but to just ask for ideas, something I can build or my IT team can build in this much time with these resources, and I always have some ideas for you. So just a side note, or what can I make for dinner? However you want to use this in your life right now, it's addicting, but it can be really powerful. I think a lot of what we had on this is probably having a big IT department type thing. So some of this you're not necessarily going to set up a server. You could use a Copilot, or within limited use cases do you have people using Claude or other AIs? Is there a preference across the organization? Is it just kind of purpose dependent?
People, I think the ultimate answer to that is different models do better at different things. And so, maybe for financials, someone wants to use Claude because it generates results that are better than this other model. The difficulty is getting your arms around BAAs and all that kind of thing. And every month it's changing. So long story short, everybody's using a bunch of different models for different things. We're trying to get our arms around them and get them safe, so that it's not just, hey, you can't put PHI in here, you can't put PII in here, to say, here's your playground, you can do whatever you'd like.
Cool. Yeah, part of the goal here is just inspiration. There's some ideas of what is being done, so you can pick and choose some things to try out here. So, and then experimenting with the different models and figuring out what works for different purposes. So is the finance one you talked about, is that on Claude? I think narrative building.
We're on Gemini or GPT-5 now.
Okay, cool. What's your favorite, personally?
I like GPT Codex. Yeah.
To have just program for you?
Yeah.
So if you just hang in there a little bit, it'll write the code for you if you don't have a big IT department. It's just knowing how to prompt it, but it's incredible. Okay. Yeah, Mike?
So, loved your first example, and you also mentioned creating code and getting that aligned with a workflow process. But then don't you have a bunch of apps? Like every week you're going to have another app to kind of have to monitor. What if you go from GPT-5 to 6? Do you have to go through
Yeah.
all those 100 apps and?
That part's easy. The model part, it's just, I mean, that part's easy. It's a line in it could be done in 30 seconds. But like the management of all the different things, you would need like a pipeline or an automation tool. So there's things like Dagster or Airflow, and these kind of have nodes for all the different things that you have going on that keep track of the health and notification, and then you don't just have, so you can organize it. Yeah, and it ends up being one big application with just a bunch of different things that you're doing.
Mike, with community link consulting makes me think of the strategy side of the board, and I just think it's important to have your board aware of this too, and to share education. And there'll be a lot of impact, I think, to make it less scary. It's good to be talking about what you're doing. Any wins, it's good for the board members to hear, and because I think being out of it a little bit, there is a lot of the room raise their hand for optimistic, which I love seeing. There is still fear and concern, of course, attached to this. So educating those that are kind of peripheral but have some stake in this is really important right now too, and make it more approachable and understandable for them. Okay, so with that, we're going to touch on cyber and then answer any other questions on cybersecurity, privacy concerns. Maybe I'll do some simple stuff and then kick it over to you, Cameron. But if you look at the sources of breaches happening right now, so ransomware attacks, phishing scams, phishing is still the number one. And you probably have all seen the phishing emails just get incredibly better, right? The last couple of years, it's dramatic. It's AI. It's dramatic, and 2 years ago, if our team got an email from me, they knew it wasn't me because of broken English and it's terrible. And now if it's really well worded and it's all very very nicely crafted email, they're like, "This is not Joe." It's a lot easier to tell that way, but it's incredible. Yeah, the sophistication, and then even to the point of spear phishing, where they can be so much more highly targeted. Stolen credentials is right behind that. So if they're using, one of the things that we do in the SRAs is look for passwords and usernames that have been breached, right? So they may be using the same, like a work email on a dating site or a shopping site, and then they're just not as safeguarded. And if the password's stolen and they see the healthcenter.com, you are some of the top targets and right now for these types of attacks. So they're going to be trying variations of that password very quickly. And it gets a lot more complicated than that, but that's a couple of the real basic things, not using your password out there, and then phishing awareness and education and filtering. Let's see, I'll take you here, but I'm going to have, so Cameron, you want any examples of how, I guess big theme here would be, as the bad guys use AI, we should always be asking what kind of tools can respond to this. Now there's more rapid zero-day attacks, meaning they used to see a vulnerability and say, okay, let's build something. You had just a little bit of lead time. Now they can use AI to code a tool to take advantage of that in hours. So there's a warfare happening on the cybersecurity side, but fortunately there are tools that are helping us be more responsive to that. And have you played in that area?
Yeah, we do have AI watching our security backend, so it's aware of all of the packets on our network. Recent spear phishing attempt, without getting too technical, there's a easy way to bypass a bunch of filters that we have, email filter, some antivirus types of filters, but they were able to get an email from a known person that this person has talked to before, and
so they got somebody outside of the organization's email.
Yep. Okay, a partner this person's worked with before was compromised. They used that to send an email that bypasses a bunch of our filters, and then they hosted a malicious script that was undetectable that flags them for their authenticator prompt. You have to re-authenticate, pull your phone out, and type in your code. Well, this attack is called MFA pass-through attack. So the user sees, oh, my email needs the code again or something, and they just type in their credentials and their code. And then as soon as that happens, then there's an automation script that happens on the bad guy's side. They just take that and they start logging into all the Microsoft services before they get caught. So a human literally cannot see all these things happening as they happen. Like if you're watching the logs and your eyeballs can only go this fast, AI can understand and correlate all these different activities and know that this login was initiated from 3 different services from different IPs, even though they're in the United States and we geo-block anything outside. So there's anomalous activity. How can a human actually trigger all of these events at once? And then so you can create playbooks with these tools that say, if this sequence of events happens, shut off the account, pull the tokens so they can't do anything, let me know, and then we're immediately identified. That activity was shut down in 6 minutes, and then we had a audit of all the things that these accounts tried to do, and it was too fast. They weren't able to get to any files or anything. So then you remediate and reset their password and use that as a training opportunity, and we add that to our phishing campaign emails, like our training. They clicked on a link in the email, and they thought, oh, I need to redo my password.
Coming from a trusted partner, trusted vendor, and we're seeing either the vendors getting compromised and then their accounts are being used, or very similar to vendor domains are being bought. There was a 1 instead of an I in one of our customers for their contractor building a new building, and they said it's time for the next grant disbursement, and that was caught last second because fortunately, we just need our team to be really paranoid. And in that case, someone on the finance team said, I really thought I already paid this. And it was $500,000. And they stopped and they checked and they said, this is the 1 is an L, or L is a 1 in that name, and caught it from going out. So it's technical, but it's important no matter what your role is. They're coming for us, for you with these types of attacks. So it's a great challenge back to your IT vendor, your IT team to say, do you want to share the vendors that you like in this space yet? Any examples?
We've gone through a bunch. We've landed on a good relationship with Darktrace. We have email filter. I won't say the names. I don't remember which one they're on now. And then a lot of the Microsoft suite's gotten really good. Defender's great. And then we feed everything into Sentinel, and so they can all kind of talk and share information. So you can get some really good tools integrated well, and you can see things that a human would not be able to see as they're happening.
Mm-hmm. Is Darktrace like a SIM or something?
It's not a SIM. It's this packet inspection. So we have nodes at all of our sites that are keeping track of everything that's happening, and they're all talking to a single AI brain, and so they're able to identify things that are anomalous. You kind of let it run, and it sees how things are normally, and then you test it with some bad things and make sure it flags, and then it starts learning and getting better.
You guys weren't going to get out of this without some nerd talk. It's going to happen. It's got to happen. And I guess one more note on here: voice cloning's the future, right? So we internally, some team member didn't tell me, which I think is illegal, but they recorded my voice for a couple seconds, and they were able to take that, create a prompt, and said, convince one of our team members to give a password up, right? So they called. It was my voice. They convinced the team member briefly, right? I mean, I don't know, for a moment, but they went to my desk and they're like, "You're not here." But that's something, and we're working on that because we're building some of that into Medcurity's platform and how to be aware and test and learn from that. But that's just the paranoid dinner table kind of conversation. You know what's coming. I mean, there's just a couple examples so far of realistic Zoom calls that someone wired money because they thought it really was their executives on the Zoom call with them telling them to do it. That video impersonation is coming along really quickly. The voice is almost perfect, almost no delays. So it's, again, I just want you to be aware of this because we want staff to be paranoid. I'd say just like basic takeaways are, don't trust, verify. So if the bank is calling you right after they emailed you, they said, "Hope you got your email. We need you to do this thing really quickly," and they're calling you, call them back, right? That's a good message to your finance team. Call the bank back. Call people back before you do anything transactional or confidential. Those kind of things. Like call the number that you know and make sure it's them because it's so convincing. We talked to lots of groups that have been tripped up. It's happening everywhere. So if you had it happen, just know that there's lots and lots of examples right now, and we aren't all on the cutting edge tools yet. So just being aware of where those risks are coming from and finding at least human interventions to start. Has anybody had anything really convincing on the AI side yet that you've seen? Just emails mostly so far? Okay. Lots of emails. All right. That's just an example of one of the emails we got. So yeah, make sure you're getting the security risk analysis done. It's rapidly evolving. So however you approach SRAs, make sure it's evolving with it. And I think I'm going to let us close up. Do you have any closing comments, Cameron? No. Okay, I've got a couple. Okay, Jordan.
So One thing to think about as we're really approaching the innovative era of AI within our organizations is as we're vetting these resources and we're implementing them, it's really important to think about communication with patients. So I was thinking about the comment that was mentioned earlier about how do we communicate with patients that we're using these tools. And it's important to make sure that you're updating your notice of privacy practices and how AI is being used. That's something that's really important that is becoming more prevalent, especially as I visit organizations. Make sure that that's also updated so that way you're in compliance with everything that's coming out.
Good point. We'll do Q&A if anybody has questions. I'll just say real briefly, on the Medcurity team, we've got Molly and Mel standing back there. We've got Rachel and Jordan here. We rented out a place just right down the street hosting tacos and tequila or whatever your poison is tonight. So love to feed you, and got an open bar down there. Starts at 6 o'clock. So if you want an invite, come talk to one of the team members and come. Like I said, we're here in Spokane, so we felt like we had to host something here and just be good hosts here. So if you want to come out and hang out with us, we can talk. We can do nerd talk. Cameron will be there. We can do or everything else that we talked through today. So with that, do you have any examples or questions for us on what's been adopted? Yes.
EMR, the telehealth platform, virtual dictation, virtual interpretation, if it's not the same language, and then the AI dictation. And so, do you have a recommendation on do we need to be getting consent from the virtual interpreters too, that we're utilizing the AI technology? What does it look like to overlay different vendors?
Such a good question. There's a little bit of state by state there, right? Because some states have rules about recording. You can't record anyone without getting they're okay. There might be a blanket with that organization, right? Instead of one by one, that you say this is the role you play with us includes recording. I think it's a fantastic question because it's kind of new. We haven't been recording. The patient part's pretty easy. We've done that in a variety of ways, but the vendor by vendor interactions is a really interesting wrinkle. And then just stacking those into a consent form to the patient, but taking the time to explain that this is what this means. But any other comments?
Yeah, and I think also in notice of privacy practices and maybe communication form and how your information is being used, just a quick breakdown of how tools are being used for that particular purpose, I think is helpful. I think the patient just really appreciates transparency and they want to understand, oh, you are using a tool, but this is how it's being used, and that you have protections in place. Another thing that I've seen is, if the patient has any further questions, have contact information for your compliance or privacy officer, and they can help address any specific concerns.
Thank you. I would say just if anyone has suggestions on this, another challenge has been just the amount of technology needed to do that. So it's like they have two monitors, one has the EMR screen, one has the telehealth platform, and then to do dictation, they have to have a mobile device that's listening and on speakerphone. So it's just a lot of layers for the clinicians. So it's been a little challenging.
Any comments or interesting ways of approaching that from the room? Just embrace it. Gadgets on gadgets. This is how we're doing it. Hopefully some of it gets more ambient, right? And yes.
I would just add to that, and then if you have a remote server that you're going into, but to be able to do the session, you have to be outside of the remote server. That's a whole nother level.
Yes.
Basically, right, Cameron, just is what it is?
Yeah, I mean, we've gone both back and forth. We've done that way, and where we've landed now is the provider has a laptop, an iPad, and they usually leave their laptop outside the exam room, maybe in their office or a hallway, and they take the iPad in and do the AI scribe. But we've tried to not use the Citrix and that kind of thing, so they're not rotating apps, and try to make it less friction for our providers.
With those listening devices, whether it's an iPad or an iPhone or something like that, there is a conversation about I'm going to use my own personal versus I'm going to use the company provided. Is there a good line in the sand to think about when when your provider says, I don't want to carry this other thing or something like that? Like, how are you guys approaching that?
Yeah, we just have a policy that their device needs to be enrolled and protected, so we verify all the patching is done and all of the things on their device is done. They generally don't want to use their personal device in that scenario because that means that their device can be wiped and read, and so we offer them the option. Actually, I don't think we have any providers that are using personal devices anymore.
Just
Yeah.
providing them a tool.
Yeah.
Can those be shared between providers? So like I can have, or do you buy one device per provider?
I think they each. I don't. Do you know that?
They log into it, so they could be, but they don't have to log in.
It's like one per exam room kind of thing.
We just have one per provider.
Per provider?
We haven't been sharing yet, but you could. It's just that, yeah.
It's probably easier for them to
probably
just
easier.
have it
Yeah,
logged
they
in
keep
and
charged
yeah.
just use it.
Got just a couple more minutes. Yes, sir.
Yeah, I'm not familiar with the resource footprint for some of these smaller, like kind of bespoke models, but I know, as these tools proliferate, these kind of large data centers are growing, across the country. I come from southeastern Washington, and in particular northeastern Oregon has them everywhere, and they're, driving up electricity costs of water. So I'm curious for an audience, of community health organizations, how do you square that kind of ethical concern of, we're utilizing these tools to support our patients, but at the same time, potentially increasing the burden on folks in communities that may already be depressed elsewhere.
You got
So,
that one, Joe?
no, I mean, I think it's a very, very important, big question for us because we're using it personal, we're using it professionally. I'm going to be on the techno-optimist side, or I'm going to say that health centers will be really disadvantaged to not, our patients will be very disadvantaged to not take advantage of this. It's such an impact on quality of care and efficiency over the coming couple of years that there is a footprint issue but we're great. You gotta have to decide where you're going to land on it, but it's too revolutionary to how we practice medicine in the coming couple of years for health centers to stay out of it. More comments?
Well, just like you had some recommendations on, considering the vendor's ability to secure their data or to make sure that they are credentialed in the right ways. Are there ways that organizations like these can put pressure or vet vendors to make sure that they are, either utilizing resources in a responsible way or renewable resources? Is that something that you have some feedback on?
Not feedback yet. That's a great big question for us to wrestle with over the next couple of years because it's going to be that impact. Potentially, that's where the jobs are that are growing in a couple of years from now would be in those areas. So it's fantastic, but we have not pressed into that yet. I guess taking some of it in-house, like Cameron showed an example, what you can build on in-house gives you more freedom. If you wanted to take, if you take concerns on that side and you want to not be a part of that, then you could invest the money to bring it in-house, and you're paying a little bit more, but you're owning that footprint yourself and a little more control over how it's used. You're still getting some of the output from the big processing, but you're taking it into the building. So there are options, but potentially vendors down the road might be a bigger part of the conversation we have in a few months too, is how, as this proliferates, can we be part of the pressure to do this responsibly? Please keep asking that question. And if you got great ideas, let us know. What organization are you at?
Department of Health.
Okay, great. Thank you for bringing up the question. I think we have more to learn, but it's evolving quickly, and I think we can't be on the sidelines, though, regardless. That's time. Come talk to us after if you want. Thank you so much. You guys are great. Thanks for participating, being a part of it.